Well, 2019 has been a rough year concerning vaccine preventable diseases. We've seen it with measles, we've seen it with diphtheria in some countries. And another one is really quite tragic because this is a disease we've made so much progress on over the years. However, it's kind of reversing itself in 2019, and that's polio. And we're going to talk about some of the numbers, some of the issues, and I'm going to take a look at one country specifically to see what's going on there. But right now, what's happening now today concerning polio. And there's two types of polio. There's wild poliovirus type 1, the only wild poliovirus that still really exists. And then there's the circulating vaccine-derived polioviruses, which I'll give you a definition momentarily. But here we can see some of the numbers. And so far, year to date in 2019 globally, there's been 85 wild poliovirus cases. The same period last year, there was 27. And in all of 2018, there was a total of 33. So we're seeing there's 3 polio endemic countries left on the planet. That's Afghanistan, Pakistan, and Nigeria. Now, Nigeria hasn't seen a wild poliovirus case since 2016, so they're getting very close to be considered eradicated. However, no such luck in Afghanistan and Pakistan this year. And so far, Afghanistan has seen 16 cases, and Pakistan has seen a total of 69 to date. And to put that in perspective, in 2018, last year, at this time, Pakistan saw a total of 8. So it's really shot through the roof in Pakistan. In addition, we've seen a lot of vaccine-derived polioviruses last year and this year. But I would say the big difference is we've seen about the same amount of cases so far to date, somewhere in the high 80s. However, there seems to be a lot more countries reporting it in 2019 than there was in 2018. We're seeing countries that didn't report any last year, like Angola, which has reported 18 cases so far, and of course there was none last year. Benin is another one, Central African Republic. And then, of course, more countries in Asia have reported vaccine-derived poliovirus cases this year, including China. Myanmar has reported half a dozen, and the most recent one, of course, has been the Philippines. And that's that's a country we're going to take a look at towards the end. There's a lot of concern going on there in the Philippines. And just to give you a snapshot, here's a map of the polioviruses. The dark orange are the vaccine-derived cases in 2019. The lighter orange are the vaccine-derived cases from 2018. And of course, the blue cases are the wild polioviruses, all Afghanistan and Pakistan. So year to date, we've seen so far 85 wild poliovirus cases through October 6th. And year to date last year, it was about, less than a third. And the circulating vaccine-derived polioviruses are about the same. However, like I said, you can see that if you look at the dark orange ones, there's been cases that popped up in different areas of Asia that we didn't see last year, though we did see quite a few in Papua New Guinea and Indonesia. But this year, of course, Myanmar, China, and the Philippines. And then a lot more different countries and places in Africa that have reported vaccine-derived polioviruses in 2019. So this is all very troubling news for something that we're really, really getting close at. So just in case you aren't aware what a vaccine-derived poliovirus is, here's a definition from the Global Polio Eradication Initiative. And they say vaccine-derived polioviruses are rare strains of poliovirus that have genetically mutated from the strain contained in the oral polio vaccine. The oral polio vaccine contains a live, attenuated vaccine virus. When a child is vaccinated, the weakened virus replicates in the intestine and enters the bloodstream, triggering a protective immune response in the child. Now, like a wild poliovirus, the child excretes the vaccine virus for a period of about 6 to 8 weeks. Importantly, as it is excreted, some of the vaccine virus may no longer be the same as the original vaccine virus, as it has genetically altered during replication, and this is called vaccine-derived poliovirus. Now, what we are mostly seeing are these circulating vaccine-derived polioviruses, and GPEI says, on very rare occasions, if a population is seriously under-immunized, there are enough susceptible children for the excreted vaccine-derived poliovirus to begin circulating in the community. If the vaccine virus is able to circulate for a prolonged period of time uninterrupted, it can mutate and, over the course of a year to a year and a half, reacquire neurovirulence. These viruses are called circulating vaccine-derived polioviruses. The lower the population immunity, the longer these viruses survive. The longer they survive, the more they replicate, change, and exchange genetic material with other enteroviruses as they spread through the community. If a population is fully immunized against polio, it will be protected against the spread of both wild and vaccine strains of poliovirus. Now, let me just point out that the Global Polio Eradication Initiative also have some very handy little simple cartoonish type videos that explain vaccine-derived polioviruses. So I'll link to that down below if you want to take a look at them. They're worth watching, especially if you're not familiar with it, and it may really illuminate to you what these things are. Now, just to give you a little history, because like I said earlier, the progress that we have made on polio, it was off the charts. We were doing such a great job, and let's see how good of a job we were doing. In the 1950s, effective vaccines were developed and have been used around the world since then. This allowed some richer countries to eliminate the disease entirely in the 1960s and 70s, like the United States. But large outbreaks continued around the world, and in the 1980s, the estimated global number of paralytic cases was over 350,000 per year, and it was still prevalent in 125 countries. So we're talking, 3 or 4 decades ago, well over 250,000 cases and more than half the world. Now, the Global Polio Eradication Initiative was founded in 1988 to fight the virus spread and disease burden with a global vaccination campaign. Since then, since 1988, the world has made rapid progress against the disease, and up until 2016, the number of paralytic cases was reduced by 99.99%, with 42 cases that year worldwide. And as I mentioned earlier, just last year, the total number of wild poliovirus cases was 33. So, and a lot of people were talking about this could be the next eradicated infectious disease in people after smallpox. But the numbers haven't been that great this year, as I showed you earlier. Now, the World Health Organization published this last week, and the 22nd meeting of the Emergency Committee regarding the international spread of poliovirus had a meeting in September, and they discussed the polio situation this year. And they reviewed the data on wild poliovirus and circulating vaccine-derived polioviruses. Let's see. And they talk about some of the countries, different recommendations for different countries. Here's some of the really serious words they had to say. Concerning wild poliovirus, the committee is gravely concerned by the significant further increase on wild poliovirus 1 cases globally. And their numbers, of course, are a little bit older than the ones I showed you earlier. So right now it's up to 85 so far year to date, while there was like 26 year to date last year, with most of the increase due to ongoing outbreaks in Pakistan. In Pakistan, transmission continues to be widespread, as indicated by both AFP, which is acute flaccid paralysis, surveillance, and environmental sampling, although the Khyber Pakhtunkhwa province, I hope I didn't say that wrong, but was of particular concern. The increasing refusal by individuals and communities to accept vaccination is a serious setback to eradication. And it's not just Pakistan. There's other countries that are doing the same, are struggling with the same issue. But Pakistan is of particular concern because of the wild poliovirus. Highlighting these concerns, the committee noted that based on sequencing of viruses, there were new and recent instances of international spread of viruses from Pakistan to Afghanistan, in addition to an earlier reported exportation of virus to Iran without further transmission. So, a lot of problems there. In Afghanistan, the deteriorating security situation has seriously hampered progress toward global polio eradication. Inaccessible and missed children, particularly in the southern region, mean that there is a large and growing cohort of susceptible children in this part of Afghanistan. The risk of major upsurge in cases is growing, and other parts of the country that have been free of wild poliovirus for some time now is now at risk for an outbreak. So, big problems there. In Nigeria, like I mentioned earlier, there's been no wild poliovirus since 2016. And if all goes well, the African region as a whole will be certified wild poliovirus free next year, if all goes well. But this is going to require a careful assessment of the risk of missed transmission in inaccessible areas of Borno and other parts of the country. And there's a lot of trouble going on there. And let me just point that out real quick. And this is from Rotary, and they just describe it. It says, polio vaccination campaigns are difficult to carry out in northern Nigeria, where the Boko Haram insurgency has displaced millions of people, leading to malnutrition and spikes in disease. When security allows, health workers diligently work to bring the polio vaccine and other health services to every child, including going tent to tent in camps for displaced people. But this has been going on for 10 years. If you don't know anything about Boko Haram, it's something worth Googling and learning. What they're doing in northern Nigeria and some of the surrounding African countries, it makes some of the Middle Eastern terrorist groups look mild. This is really a brutal group of people, and because of them, there's a lot of concern about health and disease, in addition to a myriad of other problems in northern Nigeria. So going back to the WHO statement, then they talk about the vaccine-derived poliovirus, and of course there's been a number of vaccine-derived cases, both circulating vaccine-derived poliovirus 1 and 2. A lot of it on the continent of Africa, and it says that it's now at unprecedented levels and needs to be treated by countries as a national public health emergency. So, yeah, very serious. We've seen it in a lot of countries. Countries that didn't see any recently, didn't see any last year, like Ghana and Ethiopia, Benin, they're all seeing it this year. And also, we're seeing it in parts of Asia, which I've already mentioned. Lots of concerns, particularly in the Philippines. There's a lot of concern going on right there, and we're going to talk about that a little bit toward the end. Myanmar, that's already seen a half a dozen cases of circulating vaccine-derived poliovirus 1. It looks like they've gotten the situation in Papua New Guinea under control. There hasn't been any cases this year so far, and they saw about 25 last year. So that's some good news. Conclusion, the committee unanimously agreed that the risk of international spread of poliovirus remains a public health emergency of international concern, and recommended the extension of temporary recommendations for a further 3 months. And they considered the following factors in reaching this conclusion, and this includes wild poliovirus 1 exportation from Pakistan to Iran and Afghanistan, ongoing rise in the number of cases and positive samples in Pakistan, and a lesser extent Afghanistan, quickly increasing cohort of unvaccinated children in Afghanistan, urgent need to overhaul the program in Pakistan, and on and on. So it's Anyway, it is a big problem, and it's clearly an underreported problem. I don't think a lot of regular news, your cable news, they're even looking at this. But like I said, this problem is more than tripled so far this year compared to last year, and something that was so close, getting so close, looks like it might be slipping through our hands. Don't want to be hyperbolic about it, but there are some serious issues going on. Let me go ahead and do a little spotlight on the Philippines. And the Red Cross over there is expressing some alarm over this outbreak. They've had 2 vaccine-derived poliovirus cases so far. And the Red Cross warns that up to 11 million Filipino children under 5 face a risk of death or disability. And the International Red Cross says this is an alarming comeback of poliovirus, and it prompted the government to declare a national emergency. That this is the first time polio of any sort has been seen in the country in 19 years, and I think there hasn't been any wild polio virus since 1993. So it's been a long time. So this is a huge deal. Chris Staines, head of the International Federation of Red Cross and Red Crescent Societies in the Philippines, says as many as 11 million Filipino children are at high risk. We appeal to all parents to protect their children against the virus during this massive synchronized nationwide campaign. The Philippines has eradicated polio before, and together we can do it again. But there's a lot of problems going on here. And here, let's take a look at some of the numbers. The low immunization rates have contributed to the outbreak. Immunization coverage in the Philippines for oral polio vaccines is 66%, but needs to be 95%, according to the World Health Organization Philippines representative. So far, only 40% of children under the age of 5 have received a polio vaccine by an injection. That means 3 out of 5 children under 5 have not been vaccinated. So really a really big problem. The Duterte administration has been criticized for its botched response to a dengue vaccine controversy in 2017. You can remember, and on the website outbreaknewstoday.com, I wrote about it quite often, about the Dengvaxia problem they had over in the Philippines. They immunized 800,000 children, and it really backfired on them. In 2017, the Duterte administration banned Dengvaxia, and it really caused a lot of people in the Philippines to be very wary of vaccinations in general. And we saw that earlier this year with the large measles outbreak the country had. And now we're seeing polio cases. And polio is the 3rd health emergency this year in the country. Right now, it has one of the highest dengue fever outbreaks in the world, measles outbreak, and of course the polio outbreak going on right now. And go ahead. Lastly, the Department of Health put out this, and this came out Friday. The Department of Health reminded mothers and caregivers of children 5 years and below that they could still bring their child to the nearest health center for the patak polio immunization. During the first round of synchronized polio vaccination we conducted in the city of Manila the last couple weeks of August, we were able to give the patak polio to only 54% of our target. This is unacceptable. This is far below the required 95%, according to DOH Assistant Secretary Maria Rosario Vergeri. To evaluate the implementation of this activity and determine reasons for the dismal coverage, the DOH went back to the barangays, which would be villages to us in the West, and conducted a rapid coverage assessment. Results from the assessment identified several factors why some eligible children were unvaccinated during the vaccination activity. The rapid assessment showed that most of the parents or caregivers, about 4 out of 10, with unvaccinated children, reasoned that they or the child were not around during the vaccination schedule. Other factors stated by parents and caregivers are unawareness of the vaccination activity, they were not around during the schedule and caregivers could not make the decision, their children were sick, and that they already had their children vaccinated by a private doctor. Some parents and caregivers also stated their lack of trust in the barangay health workers and the lack of trust in the vaccine. There's your big problem right there. That is a huge problem. And the Philippines is also battling not an outbreak, but a increase in diphtheria this year too. The DOH reported. So, Secretary Viguerie emphasized there is no cure for polio. It can only be prevented with 3 doses of the polio vaccine that are safe and effective. And she's really urging people to vaccinate their children, not only against polio, but measles and diphtheria and tetanus and pertussis and et cetera, et cetera. So many things that would just bring a better public health status to the Philippines altogether. Anyway, so if we look at this, overall, we do see problems. The problems with polio around the world do appear to be either refusal or afraid to, or somebody preventing you, when it comes to different violent groups from getting vaccinated. And it's causing a lot of problems. And unfortunately, we're starting to see an increase in wild poliovirus in 2019. All right. And don't forget to check us out at the website, outbreaknewstoday.com, the podcast, Outbreak News Interviews, which can be found on the website, on Apple Podcasts, Stitcher Radio, and Spotify, and the Outbreak News This Week radio show, which is aired Sundays at 1 p.m. Eastern Time in the Tampa Bay area on AM 1380 The Biz, or online streaming at 1380thebiz.com. And check out our social media presence, Facebook at Infectious Disease News, and Twitter at BackDman63. Outbreak News TV is a production of The Global Dispatch. Copyright The Global Dispatch Incorporated, 2019.